It's been well described that in the context of optic neuritis, thinning occurs within the retina of both the retinal nerve fiber layer as well as the ganglion cell layer. And so thinking about the histopathologic correlates of those layers, we know that the ganglion cell layer is where the neurons, the retinal ganglion cell, neuronal cell bodies are located, from which the axons emanate and then form the retinal nerve fiber layer as they course along the innermost part of the retina, and then coalesce at the optic disc to form the optic nerve. So when optic nerve damage occurs, this results in retrograde axonal degeneration, which can be detected as thinning of the retinal nerve fiber layer and subsequent neuronal cell death of the retinal ganglion cells, which also can be detected as retinal ganglion cell layer thinning. And the optical coherence tomography is a technology that allows us to acquire high-resolution images of the retina from which these individual retinal layers can be segmented and measured. And we can assess the thinning of these layers both over time as well as in cross-sectional studies as well. So that has been well described. And optic neuritis is a core clinical characteristic of multiple sclerosis as well as neuromyelitis optica spectrum disorder. And so there's a lot of interest in using that as a potential outcome measure and to monitor the disease course in these conditions. So in multiple sclerosis, it is well established that subclinical thinning of the retinal nerve fiber and ganglion cell layer can occur. So what I mean by that is that outside of the context of acute optic neuritis, patients may have thinning in eyes that have never experienced a history of optic neuritis. And there are multiple mechanisms that may be at play there, including subclinical optic neuropathy or subclinical optic neuritis, so lesions involving the optic nerve that just did not manifest as a clinical episode of optic neuritis. Retrograde transsynaptic degeneration is a potential other mechanism from lesions involving the posterior visual pathway, as well as potential, it's been proposed that there may be primary retinal pathology occurring in MS, where this may occur as part of a more global neurodegeneration occurring in multiple sclerosis. Now, while it's been well established that in multiple sclerosis, there is a significant amount of subclinical disease activity as well as neurodegeneration occurring, in neuromyelitis optica, a progressive disease course appears to be incredibly rare, and it is quite controversial on whether there is inflammatory disease activity or disease activity in general occurring outside of the context of clinical relapses. So that has spurred there's a lot of interest in studying this in order to better understand whether that can occur and whether it may contribute to disability in the long term. So subclinical disease activity in neuromyelitis optica. And studying the retina and using optical coherence tomography is a great tool in order to be able to study that, since the visual pathway is very frequently involved in neuromyelitis optica. So we assess this in a few studies looking at this. By various methods. One is a cross-sectional study in which we assess the retinal nerve, the individual retinal layer thicknesses in various areas of the macula, looking both at the foveal and parafoveal region and looking at individual retinal layers. And we did actually find in that study some evidence for potential thinning of specific retinal layers in neuromyelitis optica independently of optic neuritis in a cross-sectional study, supporting potentially that patients may actually exhibit retinal neurodegeneration outside of the context of optic neuritis. And then in order to expand upon this study, we did a longitudinal study in which we're following patients who were stable on treatment and had not experienced optic neuritis during follow-up. And we compared the rates of thinning of the inner retinal layers, which contain the neurons and axons, the neuronal cell bodies and the axons of the retinal ganglion cells. And we found that there was faster inner retinal layer atrophy compared to a control cohort over time, supporting perhaps that there may be some degree of subclinical tissue damage occurring in neuromyelitis optica. And notably, these are findings that have also been supported by a couple other studies as well. So there is another study from a center, multi-center international cohort, reporting that there was faster intraretinal layer thinning in neuromyelitis optica compared to healthy controls, and also a study that supported that there may be longitudinal changes in visually evoked potentials in neuromyelitis optica that are supportive also of subclinical pathology involving the visual pathway occurring in neuromyelitis optica. And one thing I wanted to mention here, an important caveat, is that when I'm referring to neuromyelitis optica here, I'm referring specifically to AQP4 IgG seropositive NMO. Because there is a more recently described and recognized the MOG antibody-associated disease, which may manifest with a clinical phenotype that is reminiscent of neuromyelitis optica. However, it seems to be pathophysiologically a distinct disease entity. And so we're interested in that as well, and performing studies there also. And we've had some reports on the utility of optical coherence tomography to differentiate actually between AQP4 IgG seropositive NMO and MOG IgG seropositive disease as well. So we are continuing to follow our cohorts of NMO participants and following them longitudinally with optical coherence tomography. And so we do have a specific interest in that, and we're performing similar studies to assess this in myelin, oligodendrocyte, glycoprotein, antibody-associated disease, or MOGAD, as well, in order to understand whether there may be progressive changes occurring in either of these diseases. Additionally, another way to evaluate this, and something that I did not touch upon previously, is to assess serum and blood-based biomarkers of disease activity, including neurofilament light chain. And that is another objective that we are actively pursuing in neuromyelitis optica and MOGAD as well.